Hello, listeners. Welcome back to Healthcare Experience Matters. We have a first-time guest on our podcast joining us today, Barry Fleming. He is the Vice President of Marketing and Business Development here at the Healthcare Experience Foundation. We have a lot of exciting chatter coming your way about the Beryl Institute ELEVATE PX 2022 conference that the Healthcare Experience team has just attended, with a lot of takeaways for our audience today about what kind of information was exchanged at that conference. Barry, I'm going to start today's podcast by having you just introduce yourself to our listeners, telling us a little bit about your background and growing up in healthcare, as you had said it before we started recording here.
Oh, great. Casey, thank you so much for letting me join this morning. Really appreciate it. Yeah, I really kind of grew up from healthcare. I was coming out of college, and my first job was right into an organization providing customer service and in the healthcare industry. And talk about stepping into a world that you really didn't know and understand. And I have a computer science background, which is an interesting way of getting into this. And one of the first things I remember was, hey, Barry, we need you to go up to Three Rivers Cardiac just outside of Pittsburgh and work with that team and be able to work with their infrastructure for the database and everything, and kind of thrust there. So this is going back to the early 1990s. And then over the past years, I've been in healthcare probably over 23 years. I've made a couple different steps here and there, but I've seen healthcare evolve. And one of the things was exciting was that my first job was they had medical records by the bedside, and it was so innovative at the time, but it didn't carry through. And I'm watching us now as this is just a standard, and where we're looking at going into the telehealth. So, I got that geeky side of me, and I just really enjoy seeing this and watching it grow and evolve.
Thank you for that introduction, Barry, for our listeners. Always exciting for first-time guests here on Healthcare Experience Matters. Barry, tell us about the Beryl Institute ELEVATE PX 2022 conference. Before we talk about some of the takeaways from it, maybe for listeners who aren't familiar with it in the first place, you can explain what it is, some of the value of attending, and we'll start there.
This was ironically my very first Beryl conference, the Beryl Institute conference. And it was wonderful. I look at where it was at the JW Marriott there in Indianapolis, and I looked at the timing on this. So we're on I'd like to think this is the back edge of coming out of our pandemic, and this is where I really appreciate Jason Wolf and the folks at the Beryl Institute for making this conference in person, at the same time respecting healthcare with the fact that masks were required. So we wanted to make sure that we maintained that level of safety. And it was interesting because about 50% were on site and actually in the conference venue. 50% were attending virtually, which look at healthcare today, and we realize that's where we're heading. So it's at the same time, it was wonderful to get back together. We want to be able to see each other. We still did give hugs. We wanted to be able to have that collaborative conversation, which we've stepped into Zoom, which, it's almost, we have great conversations. We have used a lot of the social media and those type of outlets to be able to have stronger communication, but it still had, I still had that a little bit of blinders on. So when you're out and having larger conversations in a group, it just was wonderful. It was dynamic. We were all sharing about how do we go through and work with the patient experience. That's what, ELEVATE PX, right? That's what it's all about. And as we learned, and I'll talk about this a little bit maybe in upcoming statement here, we looked at what has patient experience now moved towards because of going through the last couple of years. So just a class act. We really appreciate them allowing us to get together.
Why don't we hear a little bit more about that, and this being the first in-person event that the Beryl Institute was able to put together since the pandemic. And seems like that was a bit of a theme in the patient experience now that we're kind of in a new environment and all the change that's taken place over the last 2+ years now. Do you want to tell us more about what you learned with that?
Yes, absolutely. One of the things that I reflected on when I was at the conference was where we were and how healthcare and working with the patient experience was kind of how it was headed. Where were we going and the direction and path that we were trying to, we're always building. It was like, we talked to, I'm jumping ahead to jump back. We talk about the new normal. Well, the thing was, a couple of years ago, we were still trying to find that best way to interact with the patients and teaming together and all those different aspects. And then we go into the pandemic, and now we're focused on basically working with the patients. We're trying to prevent a virus. We're trying to protect the family, the community, really working that way. And I remember looking back and saying, we're having to wear the mask. We're having to go double mask. We're having to go face shields. And, the number of friends that I have that are healthcare workers, and, I'm watching it on TV about the rash and all the things that they could do, and having, facial expressions make such a big difference in interacting with the patients. The families couldn't be there anymore. And then the stress that it has put on the healthcare industry, the healthcare workers. So what's happened, and what we noticed is that this wasn't a 6-month episode where we were kind of able to get in. We were able to have a short term. We saw an end. We didn't. That's the problem. We didn't know when this is going to end, and in essence, still in it. So now that we've been in this for 2 years, what was the patient experience is now becoming that human experience, because we need to do healing. And that's where the best way, we often, if you've ever flown, they say, put your oxygen mask on first. And why is that? Because if you can take care of yourself, you can take care of those around you. And that's what we're looking at now. We need to take care, and we need to heal our healthcare workers. We need to work with the nurses. We need to work with the physicians. We need to work with those that are just operating the hospital in general, because we need to be able to have a strong, solid team being able to provide care in order to have that strong, those outcomes that we're looking for. And that's where now, which is nice, is that in a weird way, this disruption is meaning that we've had to step back, and we've focused on other things. So now when we go back, we can rebuild the way we want to rebuild. What are the things we want to do? This is where we go to that human-centered care, working with each other, becoming the best teammates that we can, because ultimately we've got to go back to, why are we in healthcare? We are here to serve. We are here to basically allow the best quality of health we can. And that's not just patients, but everyone.
Well said. And I know part of the benefit at being a conference like this, and actually, I believe you were telling me earlier that since this conference is so important to what the Healthcare Experience Foundation mission is all about, you actually were able to sponsor it as well. Is that true?
Yeah, we were a sponsor, which is fantastic. So we had some representation. We were spotlighting our Healthcare Experience Academy, which is, with micro learning, which supports the efforts of being able to work and coach organizations and their teams, be able to become stronger, better communicators, being able to reset these standards. It really is being able to go back, and let's get back to the root of what we want to do. What I mentioned earlier, of saying that, we're going to rebuild this. We're going to rebuild our normal. It's not going, the normal past is gone. Let's rebuild it. What's the new going to look like? And it was very nice to be able to be there and know that we can support, healthcare organizations make that happen.
Part of the benefit of being at those events, making the connections, getting inspired, kind of a nice way to put a pause button on your everyday work, and it could be a nice way to get inspired. And I know a lot of times there are really encouraging keynote speakers at these types of events. Is there any speakers or any takeaways from that you want to discuss with us?
Oh, yeah, absolutely. Well, first off, Jason Wolf put on a wonderful conference, a wonderful support team to make it all happen and go. From our observation, it looked like it went seamless. I know these conferences don't always, but thanks to him for making that happen. He kicked it off, really talking about getting back to that why, how can we help, making it that human experience. So that was a wonderful way to start it off. Had us singing, so that was great. And from there, we went into the keynote, which was David O'Leary. And what was interesting about his story, and it was very moving, when he was 8 years old, he was being an 8-year-old. He was being influenced by his older kids in the neighborhood, et cetera, and started playing with fire, which we automatically know that something's going to go wrong here. And he found himself basically burned over his body, obviously in the ICU. He was in the ICU, I believe he said, for like 8 months. It was an incredible, horrific environment that what he had to live through. But what was so inspiring was he started talking about the caregivers around him, about just being able to change the bandages when you realize that it's 100% of the body. And then from there, he had to go into rehab. And not only was it the fact that he go to rehab, but, he had lost his fingers. He had, there was just part of the body that just didn't function the way it was. And this is an 8-year-old. And he was talking about his, the therapist and what he was doing to be able to motivate David to be able to continue to progress and show that there is the ability to walk again, which, at this point in his mind, maybe didn't even exist. So it was, the PT folks. It was also one of the local radio broadcasters for the baseball team who was there. And basically their commitment was, what can I do? And we looked at this and said, you know what, they were there and they went all out to make sure that David was able to create and live the life that he was destined to be able to live. Yeah. And the kind of the great part of the story was, when David basically walked again and was able to walk down the aisle for his wedding, that the caregivers were there, all except for his PT. The PT, you couldn't quite find him. But what was interesting, they actually were, I believe it was the hospital was able to hire a private investigator to go find him and bring him back in. And it was just heartwarming to know that's what it takes. It takes that extra effort. You really have to go in and say, what can I do? And you know what? I'm not a direct caregiver, but it's this and what we do in our mission in our organization in our lives is to say, this is how I can help and improve healthcare.
Wow. To elevate the patient voice like that serves as a reminder to why everyone is there and hopefully reinforces that why. Barry Fleming has been joining us on Healthcare Experience Matters today. We're recapping some of the takeaways from the Beryl Institute's ELEVATE PX conference that he recently has just attended, with some nice fresh takeaways for us from the event. Barry, I'm going to pass along the final word to you today. Is there any other closing statements that you wanted to leave with us about what you take away from this, what sounds like a very inspiring event that you were able to attend?
Thanks, Casey. I think, one was being able to have the camaraderie in the group around us, and that was by everyone who was in attendance. We were there with a partner of ours, PRC, which was great. But there were two things, and ironically, very similar, that stood out. One was there was a wonderful lady that was from Australia, and I also met another lady who was from Mexico, and they were up there for the International Committee for the Beryl Institute. And the conversation that we had with them was the fact that we're so directed towards taking care of those in our community, right? We look at our tight community, we work out to our state, we work out to our country, but then we have to look out to the world, and listening to their stories and some of the challenges that they've had and the things that they've had to endure. It just was, again, it just really opens your eyes to say that we are really all in this together. We all have a common purpose and we have that common why, and just excited to be back on this direction again of making it happen.
I want to thank our guest today, Barry Fleming. He's joining us as the VP of Marketing and Business Development here at the Healthcare Experience Foundation. And we've been discussing takeaways from the Beryl Institute ELEVATE PX 2022 conference. We'll be sure to link to more information about this event in the episode description today, as well as we will link to the Healthcare Experience Academy. A lot of the exciting things that Barry had mentioned on today's podcast will be available with further information there. Thanks again for joining us today, Barry.
Thanks, Casey. Just happy to be here.